So welcome everybody to the November's Digital Inclusion Forum. My name's Rachel Forbister. I work for Health Innovation North East North Cumbria. I'm your chair today. We have a fun-packed agenda for today. So firstly, we are joined by Sarah Slight from Newcastle University, who has a health programme which stands for Harnessing Artificial Intelligence to Lead Transformative Healthcare. We've then got Matt Atkinson from Waymark and putting his Digital Poverty Alliance ambassador role on around reimagining digital inclusion. And last but not least, the wonderful Bryony Evans from the Good Things Foundation. So she's going to share all of the things about what they're doing on a mission to help other people be included. So that's our agenda for today. So just some housekeeping, make sure you're on mute. If not, Leanne will be forcing onto mute just so it doesn't disturb the presenters. There will be a recording of the session and that will be shared as always afterwards. The function of CC captions can be turned on at the bottom of the screen for those who prefer to use that. And please use the chat function to ask any questions. And then Leanne and I will monitor that and I will then present those questions back to our panel members, our speakers today. That's just to cover those off. For those who don't know who Health Innovation is, we're one of 15 across the UK. You can see a map of them on this slide. Established by the NHS in 2013, looking at the spread of innovation at pace and scale, not just in health, but also in care. And we work with a number of innovators as a result of that. We focus on three key things, which is one around patient safety, the second around improving population health, and as a resident in a city in Sunderland, that's always beneficial. And thirdly is around that generating economic growth through working in the system and encouraging innovation and adoption across that system. So we do a lot of different things, and we connect, as the word would say, we're a networker with local authorities, academia, NHS, etc., to really try and bring that about across the whole of our region. That's just a snippet of who we are. So today we are joined by three wonderful presenters who I've already introduced. We're going to start with Sarah Slight first from Newcastle University. So I'm going to hand over to Sarah, who will share her screens.
That's wonderful, Rachel, thank you. Great. I'm hoping you can see that, Rachel. Can you?
Yes, that's great. Perfect.
Marvelous. So I'm going to just give a short presentation on a project that we have been running here in the Northeast, and talk about aspects which relate to digital inclusivity. So as a way of just a little bit of background, the UK government published this document around air quality. It's a little old now, it's back in 2017. But it was a briefing for directors of public health. And one of the key things that they talk about in this document is identifying people who are vulnerable to poor air quality. They also talk about identifying the local sources of air pollution and trying to implement things and evaluate those improvements. And again, of course, education being also key. So the DEFRA, so the Department for Education, for Environment, Food and Rural Affairs, developed what's known as the DACI. So this, in very, very simple terms, kind of puts a kind of levels around air pollution, and if the level is low, again they say, they put messaging alongside this. So the health messages, you can enjoy your usual outdoor activities, But as the level of air pollution rises, those people who have particular health problems, whether it's lung problems or heart problems, might need to consider their actions, and again maybe take a particular course of action that would be less likely to exacerbate their symptoms. There was one interesting thing, which again in this guidance, it talks about that only a minority of people will suffer from these conditions, are likely to be affected, and it's not possible to predict who in advance who will be affected. So our research team at Newcastle University thought, well, let's explore this in a bit more detail, because we know that, again, from the literature, that when poor air quality rises and your exposure to that, we know that hospital admissions go up, and it goes up in categories like pneumonia, which would kind of make sense. It's a respiratory condition. But also, if you look at the literature, when air pollution or poor air quality rises, the number of heart admissions relating to heart failure also goes up. Again, when air pollution levels rise, the numbers of stroke admissions go up. So we thought, let's look and do a bit more work in this area. We're based in the Northeast, and we're also very conscious there's health inequalities, and they're worsening in the Northeast of England. So basically, there's a larger proportion of people, their shorter lives will be in ill health, and of course air pollution disproportionately affects those from disadvantaged groups. So we got a pot of money from the NIHR to kind of look at this area in a bit more detail, and we had a number of key objectives, but I'm just going to focus on two today. So one of the key objectives was to again to look at the data and develop a risk score to identify those who are at increased risk, and we've done that. We did that over the last 18 months, developed the risk score and published it. We also went out to people to understand a bit more about what information people want to receive about elevated air pollution levels. We also were conscious that if we were providing information in a digital way, might we be leaving people who can't access digital behind. So we wanted to mitigate against digital exclusion. And then, of course, we asked people what do they want in terms of local authority initiatives and infrastructure. So if we focus on that second objective, it was understanding what information people want to receive, but also when do they want to receive it, where do they want to receive it, and how. And again, thinking through the benefits and the barriers of each. We also wanted to try and understand the content of this messaging, and again, what kind of recommendations we should be making, and also any potential unintended consequences. So we identified relevant groups here in the Northeast. We went out to a number of different organizations to try and help us recruit participants. And again, you can see a whole network of different organizations that we linked in with. We recruited 50 people here in the Northeast. Majority were female. We had 1 in 4 were from ethnic minority groups. Also, you can see a quarter had chronic health conditions. We particularly were interested in people who wouldn't normally participate in research studies. So we, again, went to the Digital Skills Centre to try and recruit people who were trying to learn how to use digital. We went to those centres where people learn English language as a second language. And we asked them, was it your first time participating in research? And the majority, it was. Again, you can see a wide age range and also the qualifications. So 1 in 10 had no qualifications at all. So in terms of what information people wanted, they wanted to understand the risks and the harms to them. And they wanted it to be explained in a simple way, but not too simplistic. So basically using phrases like it might impact their, might influence, they might struggle to breathe. And that would be, again, a term that users said, would help them to understand the impact. They wanted it tailored to them. And they also wanted to understand information about the pollutants. So where was the source? And again, how you'd present that information. So they quite liked, traffic light coded information. And again, the location. Also, they wanted information on how they could reduce their exposure. They wanted, again, information that was potentially like positive messaging, which would minimize any kind of anxiety that they might feel. And again, they didn't want phrases where it was like you can't do something. They wanted it to be facilitative. So again, helping them to suggest things like taking an alternative route, for example. And of course, what was really important to participants was, so what's the local government actually doing about it, and the national government? So again, they produced different suggestions, recommendations on what they felt was important at a kind of a locality level. The second again, key objective, which I just wanted to briefly mention here, was again thinking about how we can mitigate against digital exclusion, specifically from those from disadvantaged and vulnerable groups. So Sarah Wilson led this piece of work, one of our PhD students. And the first question she asked herself was who is most at risk of digital exclusion? And she came up with this nice image, and she recognized 6 categories that relate to the socio-demographic factors that would be associated with digital exclusion. So obviously, cultural backgrounds, so including ethnicity and race and language, and they can impact on the the reliability of using technology. So if you think about, in the literature, again, people with a higher concentration of melatonin in their skin, again, that can reduce the reliability of some of those sensors that would be used to detect like low blood volume change, etc. The second category would be those with limiting conditions. So again, specifically hearing, visual impairments, and they can increase the likelihood of being digitally excluded. Again, differences in use and motivation to use and access. So again, those with visual impairments, for example, might rely on memory to locate certain buttons on devices. The third area was education. Lower educational attainment was, again, less likely to be, for these ones to be individuals to be interested in using digital technology and have the skills to use. Age was also another area, so older adults less likely to have access to the internet, to use the digital devices specifically to support their healthcare needs, and also obviously having the motivation to use the technology. Residency was also another important aspect, those living basically in rural or deprived areas, again, where internet's quite patchy in terms of connectivity. And finally, socioeconomic status. So again, affordability issues with regards to pursuing more up-to-date compatibility devices. Here's Sarah. So Sarah can't be with us today because she's presenting this work in the US, but she also published a paper around, again, it was a systematic review, looking at recommendations to advance digital health equity. And in this review, which was published in Nature earlier this year, and in this review, she talks about things which are important. So, identifying these strategies which are important, and thinking through the barriers and the facilitators to implementing them. So again, user-friendly designs is important, thinking about, the ease of navigation and compatibility with existing devices. She also talks about infrastructure, so giving access to devices, free connectivity, again, considering non-digital options. And the third area, which of course, again, is really important, is educational support. So people rely on family or friends or even professionals to try and help them to kind of develop their digital literacy skills. And she talks a lot more about how we can support people to do that. My final slide, or second last slide, again, work which she's done. So she went out again and also interviewed another 29 participants to try and understand, again, how we can tailor information to different specific groups. And again, that work she'll hopefully maybe present in the future to this forum, which again, just tailoring it, which I think is important. So that was my slides today. So thank you very much.
That was brilliant, Sarah. Amazing amount of work, and I know we supported Sarah. She came along to the forum, and hopefully we created some opportunities to wider connect. One of the things you mentioned was around kind of the hard to reach people, and maybe people who haven't previously been involved in research studies. How did you manage to reach out to those people and get some people on board?
Yeah, so again, Sarah and Claire led the work, but I think one of the things was again thinking about where these people might actually congregate, and if English is not their first language, then maybe the English centres is where they would go to help to learn a language. Now, I know Sarah and Claire spent a lot of time building up relationships with the gatekeepers of these organizations, explaining, again, we've loads of research studies on the go, but explaining the purpose of what we're trying to do, and then trying to get their buy-in so that they could understand and also help to bring participants on board. But they spent a lot of time. I mean, I know Sarah went out to a centre where there was a lot of mums, and again, they brought their kids, and she was trying to do interviews alongside, minding the kids at times. But again, it was just to facilitate getting hold of these people because we were interested in what they had to say.
That's great. Thank you for sharing that. I think it's always important to kind of reach out to different people. Otherwise, it's the same people all the time who put forward to be involved, and we need to understand that on a much wider basis. I've got a couple more questions. What's next? You've done some amazing, you've got some really clear outcomes there, so I'm really engaged. What would be next for that research perspective? Would it lead on to anything else?
Yeah, so we're busy again writing grants to get more funding to allow us to do more things. But one of the key things is to try and implement something and co-develop it with users. So again, should we be lucky enough to secure the funding, I think we'll go back out to user groups and participants to help us to mold and shape something that will be useful for them.
That's great, thank you. There was just a comment in there rather than a question. I've got one final one. One of the ladies, Sandra from Culture Healing Communities, said that it took her 6 months to get a number of patients involved, and it can often be quite frustrating. So I guess coming to groups like this where we're more widely connected also has additional opportunities to kind of push that out. So please, I know you want to come back next year, so that'd be great to get an update, but also so hopefully, fingers crossed, from a grant perspective, you bring some more funding in to continue the great work. We're going to hand over to Daniel. Daniel, would you like to jump in and ask your question?
Yes, please. I'm Daniel Walsh, and I'm very excited at eventually getting on board with this group, because I think I have something very valuable to offer. I'm a disabled 74-year-old, but you know what? That doesn't stop me from hopefully early next month announcing the fact that we're going to launch a remote patient monitoring and assessment tool because of the health issues that I have suffered in the past, and they are numerous. We have got it's a smartphone camera based assessment tool. It's called RPPG, remote photoplasmography, for those of you who know what that is. And we're also linking it to, I wear a hospital on my hand, and we're linking our RPPG technology to our smartwatches to assess people's day-to-day health issues and concerns. And I really look forward to sharing it with this forum and many others. For some ungodly reason, Teams in its wisdom has logged me in as my student at University of Hertfordshire, which means I can't put anything in the chat.
Oh,
but I'll sort that out eventually. Anyway,
that's great. Well,
nice
thank
to
you
meet
for that.
everybody.
Yes, really nice to meet you, Daniel.
I'll find
we'll reach
some
out
way
separately
of communicating my email address.
Brilliant, fantastic. So we've got a question from Andy Wake. Sarah, how many people involved in the research had a disability? So that leads nicely on from the comment from Daniel. Have you captured any data on accessible digital inclusion as part of that study?
Yeah, so they're great questions. What I think I'll have to do is almost redirect them. So I know that Sarah led the work around digital inclusivity and access, and would have a lot more detail that she could provide. And Claire led the work around, again, going out to the underserved and understanding how many had a disability. Again, people, so people had chronic health conditions, but they also had the option of preferring not to say. So again, it was just how much information they were willing to provide. But I can try and dig some of that out if that would be useful.
That would be great, and we can connect Andy with Sarah Wilson as well separately, for a follow-on conversation, which is brilliant. So the final question, so just 1 minute over. We've got a number of people from different organisations on the call today. What would you ask our audience to do differently based on the findings? What do you want them to think about when they go away?
So I think what we've learned, and again, this has been a journey, and I haven't really tapped into a lot of this today, but different pollutants can impact different people in different ways. And I suppose there's no kind of clear-cut effect, just low levels, high levels, which was the information that came from the UK government, and the DACI levels is really too simplistic, because different people have different conditions, and how long you're exposed to something, the particular types of pollutants you're exposed to, will have different effects. So I think what we're driving for is something that's personalized, that's tailored, that can inform people in advance if levels are going to rise, and help people to inform themselves so they can take action themselves whatever action they feel once they have that information. And it could be that they take a less polluted route and we guide them for that. Or it could be that they take their medication with them when they're leaving the house, because we're predicting that, again, this particular level can impact their health. So again, I think there's a lot of work that we need to do, but we're on a journey here, and it's exciting what we found in the last 18 months, and we're determined to try and continue on this journey.
Brilliant. That's fantastic. Well, Sarah, I'd like to thank you for coming along and giving us an update on this really important work. It's refreshing to see that digital exclusion was included as a big part of that. And I think that's, I think when you see the title, you think, what's that got to do with digital inclusion? But it has everything to do with digital inclusion and how we reach out. So we look forward to you joining us next year, or one of the team, to give updates, and fingers crossed with the grant funding. But thank you again for coming along today and sharing this brilliant update. Thank you.
Thank you, Rachel. Thank you.
Brilliant. So we are going to move on to Matt Atkinson. Matt, over to you if you would like to share your slides.
Thank you, Rachel. I'm just make sure that comes through. Is that sharing okay?
Yeah, that's sharing perfectly.
Good stuff. So I'm Matt Atkinson. I'm the Chief Innovation Officer at Waymark, which is a digital company. So we build digital solutions for our clients. My other role is as an ambassador for the Digital Poverty Alliance. And from time to time, I have presented to this group and many other groups before. But what I like to do is just to drop in and share some insights as to the sort of work that we're doing, the things that we're looking at, and especially some lessons learned as well. I often get the question, am I an expert in AI, or am I an expert in digital inclusion? I don't think I am. This is my current bio version. I think I'm 54 next year, still loading, and it's certainly work in progress. I think I learn things on a daily basis. So I'll never claim to be an expert in anything. And given the situation we find ourselves in with technology advancing so quickly, that there's a lot to keep up on. I did do a Game of Thrones bio as well, because I thought that was a fun thing to do. But the key thing in here, and the reason I'm here today, is as the ambassador role and looking at some of the things that I've been exploring. So the first thing I'll say, it's going to set my timer as well, Rachel, so I don't get told off for going over 20 minutes. The first thing I'll say is the situation that we find ourselves in today, and I often have this conversation with Andy, who's on the call today, is this VUCA situation, where things are very volatile. Things like COVID just come along and knock us off our day-to-day routines. There's this uncertainty around what's going to happen next, both from a technology perspective, but also from an exclusion perspective. The whole world's very, very complex. It's this vast, sophisticated web of ever-changing things. And there's this ambiguity as well around where data is coming from and can we trust it? Lots of different data sources, and it's hard to make informed decisions. So key questions like, how do we reinvent the NHS, or how do we achieve digital inclusion for all, require new approaches, I think, and some very careful planning as well. What we're trying to achieve, or what we need, are simple, affordable, sustainable practices, and simple, affordable, sustainable solutions as well. And digital strategy is more than just a linear series of actions. It's very complex. It's a flexible process, crucial to that progression into getting us into a better space. And one of the key things is that we need to get the balance between the unique needs of humanity and society, and we've seen some of that already today. The polls that were done, the people who are included in that first presentation, it's very difficult to get them, but once we've got them, it's really important that we begin to understand them. And if we can't connect with people, how can we connect with existing data sources and really understand what's going on? So that's the first thing, but we've got to balance that as well with technological progress. Technology shouldn't be leading the field, and we shouldn't be kind of forcing people into spaces where they're really not comfortable going. So on the next slide, I'm going to just share some lessons learned about things that I've discovered on this journey, and why we need to think more deeply, and why we need to engage with people on a deeper level to really use empathy as a guiding principle, and really to understand what's going on. The first thing here is that the traditional cause and effect practices don't always work. We had Graham Evans on a previous call, and he made the point of, look, if we don't get things right, we can actually make a bad situation worse. And this is what I'm seeing here, is that often when a problem occurs, we'll just zoom in and focus on the problem. Now, all of the problems that didn't occur but could have done, all of the other risks, the 100 other things that could have happened, just because they didn't happen, we didn't focus on them. But by focusing on the one thing that did, it kind of distracts us from the bigger picture. So this is a key problem here, is that we need to take a step back sometimes. It's good to focus on a particular problem, but then we need to take a big step back and look at the bigger picture and really start to understand what else could have happened. So that's a key lesson learned, first of all. The other thing in that is that feedback works on a loop. We see lots of one-way comms, and it's not a one-way street, it's a two-way street. So we need to ensure that when we're engaging with people, that we do include the right people in the group, and often group conversations can be a lot better and lead to better outcomes. So we need to have some more in-depth conversations, but make sure that we've got that two-way comms. And the last thing is expect unexpected connections, because I'm a technology guy, right? I work in the digital space, but then I've been engaging with clinical psychologists and all sorts of other people and learning lots of things that I never expected to get into, to be honest. So a few examples of that. First of all, anxieties. Anxiety could be false. There can be true anxieties, things we need to embrace and things that are never going to change. But a lot of things can be influenced. We can resolve them. So we deal with anxiety a lot when we're connecting with people and getting people to adopt digital technologies. And often there'll be some situations where people run away from technology. They just don't want to adopt it. And there's ways to influence that. There's ways to support them. So this goes pretty deep. And it's something, an interest now in getting to really understand what's going on. These are some of the areas that we go into to make better informed solutions and better outcomes. Biases are the same. I learned about confirmation bias. People will trust their pre-existing beliefs. They'll be influenced by that, and that will decide whether or not they adopt a certain solution. There's familiarity bias as well. So they'll trust some people, but not others within their network. And that's important as well to understand and more so, how can we resolve that? How can we get them to trust other people so that they can adopt technology? And I'll come on and give an example of this later on in the presentation. And then I learned about cognitive multipliers. So we see, especially in clinical psychology, we see this pattern where people on a monthly basis will meet with the psychologist. They'll have a face-to-face meeting, but then for the rest of the month, in that gap between physically sitting in front of somebody and the next appointment, there's nothing. And a cognitive multiplier is a digital device or digital solution that helps them to stay in touch through that period. So we're not kind of leaving them exposed and vulnerable. We're still engaging, but in a different way. So this is something that I'm particularly interested in and working with universities and other things at the moment to really understand how we can shape these different solutions and how we can support people better. So just a quick drink of water. So this brings us on to the audience, and it's vast. I think through the Digital Poverty Alliance, we mapped about 140 different personas for starters, and each one, take each of these personas, and they've all got very unique challenges. They've all got very unique anxieties that are specific just to them, unique to them, and also different biases and other things as well. So it takes a lot of time to understand the audience here and to focus on each individual one to say, okay, how can we best support this person or support this profile? And for today, I'm going to focus on Evelyn, who's the elderly grandmother. I could have focused on any of these, and actually we've done most of them now. But I'm going to focus in on one and just show you a quick example of how things could be different. So for Evelyn, this is a day in the life of. She wakes up in the morning, she starts her day, but can't really remember if she has a medical appointment today. So she's very unsure where she wrote it down. She feels a little bit anxious, knowing that sometimes she misses important reminders. She's been told off before, is how she put it. So she's had a quite a forward message from the NHS to say, you didn't turn up today, what you playing at? And she was quite upset about that. So this is the way that she sees it. She's feeling that anxiety, and she's checking a kitten wall calendar. She's got this fabulous calendar on the kitchen wall with loads of kittens and things on it. And she checks that, and she's worried that she may have missed an update. And it's those little small details that add to that stress first thing in the morning. And that's why she stood there. She's sighing heavily and she's rolling her eyes. So she's not in a good space waking up first thing in the morning. And as she goes through the day, things go from bad to worse. So Mr. Posty, as she calls him, he arrives. He's got 2 letters from the GP surgery about her next checkup. They're identical letters apart from having different dates and times. So she doesn't know. There's obviously been a bit of a clerical error there, and she doesn't know which one to trust. But both appointments are many weeks away. And in one case, she had an appointment that was 18 months into the future. So again, this is something she feels confused. She's not entirely sure what's going on or whether she can trust it. She finds it difficult to keep track of everything, therefore, the paperwork, and she's concerned that she might miss that appointment again when the time comes around. So later, she attempts to use a mobile phone, and this was dropped off. This is a good example of this familiarity bias. She loves the postie because it's a very manual transaction. He hands over a letter. They have a nice, pleasant conversation, and he goes on his way, and she feels really good about it. But then the IT person that turned up that dropped off this phone left her in a bit of a state because she asked where the manual was. He told her there wasn't one and that the interface was intuitive. She had no clue what that meant or how it helped her to use the device. She had a little bit of training. It lasted about 15 minutes. But again, she was really confused about what this thing was, and there was just too much going on. So straight from the offset, she didn't trust this IT person. She's saying it's very confusing. It's the first thing that she's ever been given that doesn't come with a printed user manual. So she's really struggling to trust it, and she really doesn't trust that whole relationship with the IT people. So she's attempting to use this. It takes ages to start up. She doesn't know that she can just leave it on and charge it up from day to day. So it takes ages to start up, and then she struggles to navigate the busy screen. She's frustrated again. She puts it back in the drawer and avoids making any calls to confirm her appointments. It's a stupid thing, she mumbles. So she's really not happy. In the afternoon, she heads to a local supermarket, the local Spar. She tries to remember if she needs to refill a prescription. She knows that she could ask a doctor to send reminders, but managing this over the phone feels really overwhelming. On the way back, she passes a local community centre, but misses a health and wellness event. She really would have liked to sit through that, and she wishes she'd known in advance, but she didn't have any means of getting that information on a timely basis. And then on the evening, she's feeling a bit isolated. She's had a tough day. There's lots of things that she wished she could have got sorted today, but she hasn't. She's watching TV and listens to the news, and she hears some stuff about health tips, but it's not specific to her. It's not specific to her own care plan, and she feels a bit out of the loop and a bit unsure about next steps for her well-being, and the medication and other things that she needs to keep well. So that's a classic. For each of the different personas that we had, this is a classic kind of day in the life of really understanding what's going on, how all of these different things are coming together. So if there's one thing I'd like you to take away, it is that how do we use empathy as a guiding principle to really understand what's going on? How do we understand things like anxieties and biases and how that's shaped, and having that accountability for really thinking through things in detail and really understanding what's going on. So a method, instead of just a classic cause and effect, one of the things that we do when we're looking at a use case like this is to just model out. We call it a system model. It's a process flow. It's just to model out the challenge. And we'll have lots of these little processes that we put together, which looks at the trigger. So what is the event that happens that triggers the process, and the different actions and outputs from each step. These are called nodes and links through the process to achieve a particular outcome. So there's lots of these going on in the story that we've just looked at with Evelyn. And there's lots of questions we can ask. And, I could have written 3 pages of these questions, but it's things like, what does she do and why does she do it? Really understanding what she's trying to achieve. What does she use to do it? So is it a telephone? Is it face to face? Is it a mobile phone? What other access or assets does she have access to that we could use? What has and what could possibly go wrong? So this is breaking the cause and effect thing. It's understanding what's gone wrong, but then what else could have happened that we haven't seen yet? So just really digging into detail around that. How long does it take? Who else is involved? What are her individual expectations or the expectations of other people involved as well? What's the emotional impact, both positive and negative? So what makes her feel good and what doesn't? And how much control does she have over the whole process? And the list goes on. Well, this is the sort of work we do to really understand things. And I think this is the answer to the problems, and if we apply this and we work through the day in the life of, again, having applied it, this gives an example of the art of the possible. So on the morning, if you think back to how it was, and this is us now digitally transformed, Evelyn's day begins really positively with a gentle beep from a health alert bracelet at 9 a.m. It reminds her to take a morning medication. Her personal pharmacy device, which looks like a little coffee machine that sits in the kitchen. Evelyn calls that Kevin, by the way. That registers the dispensing of the medication at that time. It records the dosage. And then as Evelyn takes the dosage, the health bracelet also looks at the vitals, confirming that the medication's doing its job. So we've got a full, it's a very safe process that we've recorded that Evelyn's taken her medication. There's lots of other AI-driven decisions that could be happening at this point in the background as well. So if Kevin is running low, the personal pharmacy device is running low on medication, it could be placing a repeat prescription and then sending a reminder to Evelyn to go and pick it up. So lots of things could be happening here to automate that process and cut out that human error. She's reassured by the simple, familiar routine that doesn't require any complex digital interaction. She doesn't need a user manual, and she doesn't need to navigate different screens. It just happens. And the bracelet's in a favorite color as well. It's a white pearl effect, and it makes her happy. You can see it on her arm there, so she's really happy about that. And then shortly after, she receives a friendly call on her landline. So it comes through on a phone that she's used for many years in her life. From an automated health service. It just confirms a doctor's appointment for tomorrow. She's happy about the reminder and notes creates a little note on a kitten wall calendar just to say, I've definitely got that appointment whilst it's fresh in her mind. So that's a really positive start to the day. Mid-morning, she heads out to meet a friend at the local community centre. As she grabs the keys by the front door, she notices a small heart-shaped light pulsing on her fob. That reminds her to attend a health and wellness event that she's pre-booked. She appreciates how that gentle little nudge just seamlessly fits into the routine, so she doesn't need to worry about checking her notes or digging back through pieces of paper. So that's another positive event during the day. And then in the afternoon, whilst at the local supermarket again, the Spa, Evelyn's hearing aid plays a little jingle. It's been triggered by a nearby beacon when she's at the shops. Reminds her to pick up a prescription, which is right next door to the Spa. She's pleased with that little discreet, health-conscious reminder, and it feels supportive rather than intrusive. At the Spa checkout, she's given a receipt. So she's paid for her milk and her bread, and she's given a receipt with a little message and a QR code on it. And the lady behind the counter advises her to put it in a purse for safekeeping and makes a mental note to show her daughter the next day. Evelyn realises how it's useful to get local information in places that she already visits. And later, her daughter scans the QR code using Evelyn's mobile phone and shares with her vital health information. So again, another simple process. And then on the evening, and I've got 3 minutes left, she winds down for the day. She presses the speed dial on her landline. This is really familiar, so that familiarity bias. She's used to calling the talking clock. Back in the day, she would just call a number and it would tell her the time. It feels like a similar process. She hits the speed dial. She just wanted to double check that appointment for tomorrow. It's not a lengthy wait, it's an instant service, and that service makes her feel cared for and relieves the stress of making mistakes and that getting told off. So she's finished the day on a high and knows exactly what's happening and feels completely included. And that's it. That's my future version with 2 months to go. Just a quick thank you from me. I will always share insights like this in case it helps the greater good. And if you do want to learn more or book a call with me, you can just scan that QR code, or my email address there is there as well. Thank you.
That was great, Matt. Thank you so much. I love a bit of empathy mapping. I think it really brings it to life, because ultimately, work in public sector, we have to put the patient or citizen at the centre of what we're trying to do. But unless we appreciate and understand the complexities of their day-to-day life, that can be very challenging. So I think an empathy map's a really great way to do that. What I would suggest, I know you used a particular methodology and we're sharing the slides, Matt, but there are empathy maps that we can share with people if you're ever embarking on that as part of your own work stream, that you consider, how does that person feel? What do they think? What's the type of things that they would say? So we'll share some additional materials with you as well. So we have a few questions, Matt. Well, it wouldn't be me if I didn't ask a couple myself, as you will know. The first question is from Sandra, which was around where could people get that type of equipment from? You've given that brilliant, the future, what it could look like for that patient. So just, your thoughts on that, please.
Yeah, I mean, technology is moving at a real pace, so the concern's not around getting the equipment. I mean, I know that Hero Health in the US, for example, make that home pharmacy solution. The wearable devices are pretty common nowadays as well, bracelets and watches and other things. I know Daniel was talking about that before. So the concern's not so much about technology. In my experience, one of the other projects I was working on was the ATM solution. So how might we use cash points to deliver health messaging and updates and alerts on appointments? And that's a very, very simple solution. But what's the frustration from my point of view is how long it takes for us to achieve these things. So a lot of this is conceptual. We've seen the technology proven in other countries. We know they're using it in other countries. We're just not doing it here yet. And it's, I want a little bit less conversation about it and a little bit more doing, to be honest. Because the longer we take to get there, people are suffering, and in some cases, people are dying because we're not supporting them.
Definitely. David Black has made a really interesting point around kind of we have a lot of boards, but how do we really understand the depthness of people's lives? And how do we make a change on those boards to really help that understanding? How do we get the right patients? And I guess Sarah's touched on that. You've touched on that. Brian, you probably will as well. It's how do we get the biggest impact by listening to the true lives of people? So I'm going to throw that. Have you got any thoughts or experiences being an ambassador for the Digital Poverty Alliance around that?
Yeah, we certainly, Rachel, we need, it's a great question, and we need access to people. And one of the things I have mentioned, because we do really struggle getting access to people, we've seen that already on this call. We're looking at patient involvement groups and other things. How can we connect with as many people as possible? But when we can't, how do we get access to data? How can we, we've got the ability now using AI to ask the right questions, and if we create the right prompts and ask the right questions to a database, we can get answers from that as well. So we need to get more joined up on this, and we need to make sure that we can collect information that's available from trusts and other things. I know some people in health innovation, Northeast North Cumbria, are looking at this as a project. Another Rachel is looking at that, and this is really, really important, because I think there will be that constant struggle on how we connect with people.
Well, thank you for that. I'm going to pass to Daniel, who's got his hand up, and he's one of the only brave ones to speak. So Daniel.
I'm not brave, I'm just stupid. But you know what? It's good to be honest. For some reason or another, my technology is battling against me, second to none today. I would love to have a discussion offline with you, Matt, if we can do that. My email address is daniel@digitalpoverty.ie. tdihealth.co.uk. And anybody else who is interested in remote patient monitoring and assessment, we're bringing a solution to market next month, and we are very excited to share it with the group here. But my technology is definitely not on my side today. I can't write in the chat. I can't do a damn thing. But thank you, by the way, for everything.
That's great. Wonderful. Thank you for that comment, Daniel. That's brilliant. So I've got a one from Chris. How do service providers create what are all essentially fully bespoke solutions to fit an individual, which results in a vast number of one-off solutions would often need a level of support? So where's your thinking around that?
Yeah, that's a big question. I was just smiling because I saw another question from Chris saying, where can you get a street name plate like mine, the Mac Cave? My father-in-law got me that, so I'll ask him.
Leanne has posted an option in there, and Etsy's always a good place, which I know Chris knows about.
Happy days, yeah. Sorry, so that just give me that question again, please, Rachel.
Yeah, so how do service providers create what are all essentially fully bespoke solutions, but how do we get them to fit an individual?
Yeah, so my thoughts on this is that we need to get started on this. We can't get everything right on day one, so it's about spotting, understanding the bigger picture, and understanding individual points of view. But where's the commonality? Where are the things that we can influence to get started? Yeah, it takes investment, right, to get these things out, and we work in that space all the time. We rely upon the appropriate investment to get something built. I do think we need to take that more seriously. I do think there needs to be a budget assigned within the ICB and other areas to make this happen. I think that's been one of the struggles. But again, it's about picking something that's gonna. We're very good at prioritizing ideas, and it's about picking something that's gonna have the greatest impact to the most people. Something that can be done in a timely way. Let's get some quick wins sorted.
I know,
and as we
Chris is commenting there, as an organisation, and I've been in that situation working in the NHS, we're inundated with the number of solutions that potentially could match that problem. And it becomes complex, doesn't it, as a result of that?
Yeah, it does. It does. Yeah, it does. And it is about that prioritization. So we see hundreds of different solutions. And actually, when I presented my ATM idea to NHS England, they'd seen hundreds of different solutions. But he's the reverse thinking, right? We're not talking about advanced technologies, cutting edge stuff. Something that's already there. Like how can we keep it simple? Yeah, and just get deliver some benefit, because the outcome is let's make sure that people are digitally included and get access to messaging and healthcare advice. Well, there's a million different ways to achieve that, and it doesn't always involve investing in something or building something brand new. It's just about optimizing what we have.
Yeah, and I think always look at the problem first, which is a very common, and then how does that solution, and then a bit of empathy mapping actually, because then you understand what the needs of that individual patient are, and then what the solution might match that. Otherwise, you're trying to fit a solution into something that's not there already. So it's a bit of chicken and egg situation.
So it's the most important thing. Always consider what else might have happened, because of that point I made about we'll focus on a problem, but then we'll miss lots of other stuff. So the problem might be, well, they didn't have a handheld device, so we signpost them to a device. But we've missed the fact that they're complete technophobes and they don't have connectivity and they can't get trained. It's not going to fix the problem if we don't look at it right.
I'm going to throw one more before we move on to Bryony. It's a typical question that I normally ask our speakers is, what do you want the audience to consider? What would your top tips be to those people working and looking to emphasise the importance of digital inclusion?
Yes, don't take shortcuts. Don't lead with technology. Don't just focus on one problem. We need to. We're accountable as people that are helping to shape this in taking a big step back and looking at the bigger picture every single time. I think there's a right way to do that. It isn't. Cause and effect doesn't always work. What we need to do is to study these things in detail and use empathy as a guiding principle. Empathy maps and other things. Really, really important that we we invest the time and efforts to get things right. Otherwise, we could potentially make a bad problem worse.
Brilliant. Well, thank you so much, Matt. Always interesting, great angle today in terms of doing that empathy element and that persona. Are the personas available anywhere? Would be my final thing.
Yeah, they are. They're available through Andy Wake should remind me actually, because it is through the Digital Poverty Alliance. They have got them on there. It was done in London actually. So I'll find a link.
That would be
think Andy
great. We
might
can
have the
ask Leanne
handbook.
to share.
Yeah, we'll find a link and share it out.
That's brilliant. Well, thank you very much. You can sit and relax now and hear the wonderful Bryony. So
Thank you very
Bryony,
much. Looking forward to it.
Great. We're passing over to you for the final presentation of today. So I will let you share your slides.
Well, thank you very much for having me along, and thank you, Matt, and to Sarah before as well for the presentations. It's been really interesting to listen to those different aspects, and Matt for bringing it to life as well. Yeah, I'll just share my screen now. So I work for Good Things Foundation, and we are a digital inclusion charity. Thanks for inviting me along, Rachel and Leanne. I just thought I'd give kind of an overview of our work, where we're up to at the moment, just to sort of spread the word about our thinking and what's going on at the moment, but also keen to hear people's thoughts or feedback as well. So hopefully we'll have time for some questions and discussion at the end as well. I'm going to time myself as well to make sure I stick to my 20 minutes, otherwise I might ramble on. So yeah, at Good Things Foundation, this is what we do. We're a digital inclusion charity. We've been around for over 12 years, used to be called UK Online Centres, in case anyone came across us under that guise. We briefly actually rebranded to the Tinder Foundation, but we had to change that quite speedily because a certain app came along and stole our thunder. So now the Good Things Foundation. So we campaign for digital inclusion and we advocate to try and fix the digital divide in the UK. Not to say that we want everyone to have to be online, but as the other speakers have been mentioning, I suppose, looking for solutions where people would benefit from and do want to be online. Our CEO, Helen, does quite a lot of advocacy, and our advocacy team as well. So they do go to the party conferences and have certain asks for government as well. They're trying to promote digital inclusion solutions at that government level. But we're also trying to come up with some solutions and things that we can all do in the meantime as well. So we work with partners as part of this network that we call the National Digital Inclusion Network, which is basically, well, Helen's described it before as a big club, but it's just a free membership network for any organisation that's involved in supporting people to get online. So there's about 5,000 members now, and it's really varied. So there's you see in there libraries, NHS trusts, citizens advice bureaus, some really small independent charities, big branches of big charities, and all sorts really. And it's quite interesting, I think, when we all get together in online meetups and so on to see all of that range of experience and advice as well. And then we try and look for some ways that we can provide support and services to organisations so that they can help the people they support. So there's things like the data bank that I'll talk more about in a second that helps people get free SIMs and data bundles, and Learn My Way, which helps people learn new digital skills. So one thing that we've got a small data and research team. So we do a bit of our own research, but they also try and bring together some existing research as well every year in this big infographic that we call Digital Nation. This is just a piece of it. It's actually a lot bigger, but just thought it might be interesting to bring out a few stats that they have found. So this is from the latest version of it, and lots of the data they get from Ofcom, from Lloyds Banking Group. They do quite a lot, some of our own research as well. But I think we probably all know the scale of the situation across the UK, really. But it is showing that there's still 8.5 million people that lack basic digital skills and 2.4 million households that can't afford their mobile phone contracts. This one on the left, it mentions the minimum digital living standard. So this is something that one of our directors, Emma, has been involved in with colleagues from, or professors and so on from different universities as well, working in collaboration. and they've been trying to come up with a standard, a bit like minimum living wage. So they're coming up with something called the minimum digital living standard. And the idea of that, I suppose, is to look at what would people need to be able to have a good quality of life in society as it is currently, not just to be able to meet their most basic needs and to be able to survive, but to be able to kind of engage in everything that they would want to be able to. So if you're interested in seeing a bit more about that, it has its own website. You can just look up the minimum digital living standard, and they've been publishing bits of research as they go. They've started off by looking at a minimum digital living standard for families with children, but I think they're hoping to expand that out and look at other groups as well going forward. So the bit circled here is just because they're specifically around health. So the data showed that there was 33% of those offline, so it's difficult to interact with NHS services. But also I think the other things on here are quite interesting as well, around higher food costs, online banking being more difficult or taking longer as well. And as part of this, they did look at people that are being left behind and different groups that those people fall into, or different sort of extra barriers that they might face. So they found that 48% of those who are being left behind by the digital kind of innovations and so on have no formal qualifications, 25% have a disability or health condition, and 37% of those are over 65. If any of this is going to be useful, if you want to borrow it for anything that you're doing or to quote it, feel free to. We've got everything on our website with all the sources there, if you want to drop any of this into anything work that you're doing. We're also part of the Health and Wellbeing Alliance work with other organisations as well. So we've recently had a seminar series, and it was with some of our directors and so on, and then directors and leaders from other organisations that are part of the Health and Wellbeing Alliance work, talking about designing for digital inclusion in healthcare. So there was a session of 3 seminars which have happened now, but if you want to watch any of those back, we'll send out the slides and you can follow the link and watch them on our website. Our head of research pulled together the kind of common things that kept coming up though. So she's broken it down into these areas. So the things that we pulled out of that were the importance of thinking when designing for digital and healthcare about the audience, the support that's provided. So who will provide the support? Do they have the skills, resource and confidence? And thinking about how digital champions and buddies can help. Making sure that the design is going to be accessible for people using accessibility standards, enabling translation and so on. And then how to communicate this to people and how to go to where they are rather than hoping that people find the information. So I mentioned the Digital Inclusion Network before and the different types of organisations that make it up. We do have a map on our website and it shows lots of the organisations that are members already. And it shows if they are delivering digital inclusion support in their local community. And it also shows if they've got access to free SIMs and data through the data bank and can give them out to people. It's not showing a full picture of all organisations that are working in this space, of course, or that are even part of the network, because for some, it's not going to be right for them to be on a public facing map in this way because they work with a really specific group of people and won't be able to sort of have people referred in. But the ones that are appearing on this map can be contacted and signposted to. So if there's anyone that you're working with that could really benefit from that type of support immediately, then this map is a place where you could see what's available locally. So the data bank, it's been going for a couple of years now, but very much still going, and we're open to new partners joining and helping us distribute that data out there to people that really need it. The concept of the data bank is a bit like a food bank, I suppose, but for mobile data. It first came about during the pandemic, but we've carried on going with it because it's reaching a lot of people. And it's providing free mobile SIM cards to help digitally excluded adults get connected. So lots of data bundles have been donated by Vodafone, O2 and 3. And we just call the big pot of all of that data the data bank. And then organisations that join that network can apply to receive some of that data in data bundles or SIM card form, and then gift that out for free to people that they support, where access to the internet or connectivity is the barrier for that person. As mentioned, still looking for lots more partners to get on board and kind of be a place where people could access that data. So if it's something that you want to talk to us about, or you've got anyone in mind that you think would be really well placed to do this, please do let us know. Just thought I'd put this on so you can see the amount of data, because that's often a question that comes up. You know, these networks are donating the data for free. What sort of offers are they providing? They're all slightly different because they do things in their own ways. So what we do is with organisations, we give them access to all 3 of the offers, and then they can gift those out to people. Sometimes one might suit someone better than the other, I suppose, for different reasons. They might be a low data user, they might need a lot, they might really need the calls and texts as well. Because as you can see, the O2 and the Vodafone offers include calls and texts and then data bundles, which refresh each month. The 3 offers just a data-only one-off provision, so it can be useful just to tide someone over, or if they need data for a set period of time or something like that. The way it works is we kind of want it to be a continuous service to the organisations as well. So organisations can join the network, opt into the data bank side of things, and then we'll deliver some SIMs, a couple of months worth. But then as that data is gifted out to people that they support, they can log it on the website, which is very quick and easy to do, just putting in the phone number that's on the back of the SIM as a minimum. And then they can request more SIMs. So ideally, it would always be there as a service that the organisation could provide. Of course, as soon as we started looking at data, we knew we needed to think about how we could maybe help with devices as well, because we know that is a huge barrier for people. I know there's a lot of really great schemes in this area as well. The way we were thinking about it is if we can receive donations of devices in, we can get them refurbished and then gifted out to people through organisations that are members of that network again. So this is something that's a bit newer than the data bank, but we've been through a few rounds of being able to gift these devices out. It really depends on the donations coming in though, so it can be a bit stop and start, but it's something that we're hoping to boost and make sure that lots more devices are available. So we're going to put things like that in our newsletters, so you can join up for those if you want to hear about future plans for the device bank as it scales and grows as well. And then another piece of our work is around looking at how we might be able to help people learn new digital skills. We do have a website called Learn My Way, which is where anyone can just practice and learn new skills for free. It's got lots of bite-sized topics on there about sort of the first ones that may be suitable for people that have never used a device before. So using a touchscreen or a keyboard for the first time. And then it does go on to lots of topics around managing health, online, employment, video calling with friends and family, and lots more. We're of course trying to make sure, so it's designed by our learning team and built by our digital team, which is good because it means that we can kind of vary the content and update it as needed. We've just added a topic on there that's an introduction to AI. Not promoting it as a blanket approach, but kind of helping people understand the concept and perhaps taking those first steps into thinking about it, and if it's something that they want to use and understanding a bit more about it as a whole. Be really interesting to know as well if it's something that you use and if there's any other content that's not on there at the moment that you think would be really useful to include. Do let us know. And then thinking about the people that are experiencing this, of course, our team are always kind of trying to speak to people who are working or being supported by the organisations in the network just to hear about their experiences, and especially those that have received some support, how it's affected them. So they went out to one of our partner organisations, Learn for Life, and met Julie, who received a refurbished laptop, data from the data bank, and some support from Learn for Life to use it as well. I just thought it was interesting to include because some of the emotive language in it, I suppose, because, you know, I think I've been talking a little bit about statistics and solutions, but just a reminder for me, I suppose, as well, that it can be a really emotive issue for people. So Julie says that she felt frightened and it was the fear of the unknown, and she felt intimidated and angry that she was being left behind because not everyone can afford a laptop and Wi-Fi internet. And she said that she felt she would have been letting the world go by, and it's given her a new lease of life and a sense of freedom. And she's living life on her own terms. So yeah, that was my quick whistle-stop tour of our current work at the moment. I'll put my email address in the chat panel actually, rather than the contact us one on the website, in case anyone wants to reach out afterwards. But more than happy to sort of answer any questions anyone might have now, or if you've got any thoughts or feedback or anything that you think we should be looking into more in the future, that would be really good to know as well.
Fantastic, Bryony. I'm always so impressed with the amazing work that the Good Things Foundation do. And it was great to have you along as a speaker today to kind of share that amazing work with lots of other people. And I've asked the questions that you've mentioned as well, just to see if there's anybody who's already currently using it. So we might get a couple of comments around that. I've got a couple of questions myself, as well as just some general observations or comments.
Of course.
When I use your Digital Nation slide quite a lot, because it's a really good context for setting the scene. I always recommend other people use it. And the one thing for me is the data always scares me, because I must live in this little bubble, and then you look at that and you think, oh my gosh, how far behind, and you know, fixing that digital divide has to be one of our priorities. And I'm always, as I say, really shocked by that data about how many people are excluded. And then when you do a deep dive, and I know one of the questions is around, have we got any data for the North East? We're doing some work with the SID with the renal team, and they did a deeper dive into the digital skills of their dialysis patients. And 38% of those dialysis patients didn't have access to a smart device or data. So it's can be even more prevalent in particular communities or particular health conditions. So we're going to try and fix that as much as we can, and we're working on that project. But it's just to kind of provide a comment around that. So one of the questions from Sandra was around, it's brilliant to see that national data set, but is it chunked down into regions? So could we see things for North East North Cumbria that can kind of say, oh my goodness, that's something that we need to focus on?
So the information that's in the Digital Nation infographic, I haven't seen a regional version that would be in that much detail. A lot of the data does come from Ofcom, and I think they look at it more as a UK-wide basis, as far as I know. And from Lloyds Banking Group as well. But it's something we can always ask. So our head of research, Katie, is the expert in this matter. So it may be that she's come across in her reading things that would be more relevant at a regional level. So I can always take that away and find out a bit more.
That's brilliant. And there's probably something we can share that Thrive by Design did, which is like a heat map for the North East. So that might help Sandra, just as an example, or it's a little bit complicated to use, but I'm sure Thrive would be able to explain it fully. But yeah, that's brilliant, Bryony. Thank you so much for that. One of the other things was about the data bank. So it's quite easy to sign up. There's obviously how many weeks before people generally get you kind of the go ahead and access that?
Good question. So we just have a form open at all times where organisations can say, yep, we want to be involved in gifting out the SIMs. What the team do is it's open every month and then it closes at the end of the month. So there's, say, a November form open, and then it takes a couple of weeks at the end of each month for the team to just review all those applications and then send out emails, order SIMs. So they do that process once a month. So in general, I'd say if an organisation applies in a certain month, like November, by the end of the following month, they'd have everything that they needed to get started, like SIM cards, We have monthly onboarding sessions, we call them. It's just a training session on Zoom where any staff or volunteers that are going to be actually gifting the Sims can come along too, because then they can learn about the differences in those offers from the different networks, and we can answer lots of questions and so on as well.
Brilliant, thank you. I know one of our GP practices recently signed up, and they got their SIM cards. How empowering, they're in a high deprivation area and never really known about it before until I'd mentioned it. And honestly, how it's made them feel, being able to help patients in a different way, has been phenomenal. So
amazing.
So there's some really good stories out there. So I'm a big believer in it. You probably get lots of referrals as a result of all the work that we're doing. But the more, the merrier, is what I would always say.
Yeah, definitely.
So you shared some great kind of insights into the stuff you're doing and Learn My Way. How did you involve patients in sit-ins and in kind of some of the core production of that to really understand how it works?
Yeah, so we recently, in the last year, I believe, had a new version, because Learn My Way is something that we've had for a really long time, as long as we've existed really as an organisation. So we have to make sure that it's still fit for purpose and all the content is up to date. So we not too long ago launched a new version of it. And I know my colleague Mary, who leads it, they went through quite a lot of testing of the new content and the changes. So we mainly did that with different organisations that are members of the network, because some of them use it in learning sessions, or digital champions use it as well. So we wanted to make sure that they were involved too, and then getting together groups of their learners. We tried to make sure that, there's some that use it all the time, every week, and are really, really familiar with the site. And then there's some that might dip in every so often. So we tried to involve organisations from both categories, if that makes sense, not just ones that were already really involved with it, and not just people that had already used the old site before. So it went through a few rounds of that testing, really, to try and make sure it's as suitable as possible. And then we try and respond to kind of, I think there was it's got a text to speech function, for example, and it was something that wasn't available in the new version of Learn My Way, but there was a lot of feedback that was really, really useful for people. So they managed to get it added back in. So that's available again now, which is good.
That's great. And I love the kind of bite-sized chunks, because it is, I reflect back on my gran, she passed away a few years ago now. But she didn't understand those modern terms. So we were sitting in the doctor's surgery. She had dementia as well, which didn't help. And, on the sign, it's got free Wi-Fi, and she's going, you can get a free Wi-Fi in here, because she didn't know what Wi-Fi meant. So, she was making a joke out of it because she didn't understand. But, it's just kind of those things like artificial intelligence. I've shared the link to that short video actually in the chat, because, sometimes the normal person out there, they're not working or embroiled in the digital world that we're in. So sometimes they don't know those simple terms or the impact, or they just think of robots are going to take over the world. And, it's kind of allaying those myths, isn't it, more than anything? Which is really
definitely.
good.
Not assuming that everyone is going to understand certain terms, as you say, 100%.
So I've got no other questions from here. The only thing I want to ask was, Daniel, you did have your hand up. Did you have a question for Bryony? Unmute. You need to unmute. Daniel, you need to unmute your computer. That's it.
I never said I was intelligent, but there you go. Thank you for reminding me. I have already written to Matt and to Bryony. Brilliant presentations, both of you. I think there is a lot that we can do together.
Well, that sounds brilliant. Well, there's an offer, if I've ever heard one, to both Matt and Bryony, and Leanne will connect you on email to see if there's any collaborative opportunities. That's brilliant. Thank you for that comment.
Thank you.
So my final question is always very similar. It's kind of, we've got a captive audience. What would be your top tips for people to get involved with digital inclusion and the Good Things Foundation? And what would you recommend as the priority area for them?
I think, feel free to have a look at our website, and you can have a look at the Digital Nation infographic and use any bits and pieces that you find useful on there. But also We, of course, really want to spread the word about the data bank, whether that's to organisations that could be gifting Sims out to people they support, or if it's just making people aware that there's a map where they can see where people can access that support locally to them as well. It's something we want to make sure is used. We've had lots of data donated. There's still lots available. So we want to make sure that people are connected with that support where it's going to be useful for them.
Brilliant. And I would find it really useful for those listening into the call is just to pop in the chat, yes, we intend to access that data bank, just to see what the appetite is, or if people knew about the data bank, and whether that's been something refreshing that they can take away. So just pop that in the chat as we go. But Bryony, just to say thank you so much. That was an excellent presentation. As I say, I'm just, you must be really proud of the organisation that you work for and all of the good work that they do. And I know certainly it's been a pleasure being in contact with the company over the years. And I'm always very impressed, as I say, with what you do. So we're coming to the end of today's session. So I'd like to say just a personal thanks to our three speakers today. So we heard firstly from Professor Sarah Slight from Newcastle University about the digital exclusion in links to air pollution and different information. We heard from the excellent Matt Atkinson, CEO of Waymark, and he really gave us an insight into the art of the possible, but also around that kind of empathy mapping and personas. And there is a link in the chat that Matt has put in there so you can read further information. And last but not least was the wonderful Bryony sharing not just about the data bank, but the wider work that they get involved in, and all of the resources that are available on their web pages as well. And if anybody hasn't seen Learn My Way, it's a brilliant introduction for people who just are technophobes and don't know where to start. I think that to me has always been a place I've referred people to, because as you say, Brian, it's been around for a number of years. Also thanks to our participants, because without you guys, we wouldn't have content to share. But it's always great to see things being popped into the group chat. And we've also got Andy Wake, who shared some additional information in there. There's information from Google on AI, etc. So there's some further reading, but Leanne will pull some of those into the email that she will share. Thanks to Leanne, because she's the one who works the magic in the background, setting everything up. I'm just the one who talks and far too much normally. But it's just to say thank you. We've got our next forum is on the 10th of February. Am I right, Leanne? Keep us right. The link will be set up. Yeah, we should be getting the link set up for next year's forums. We're trying to mix them up a little bit. I love this format of getting 2 or 3 speakers because we find out it's about some brilliant local or national work, which we wouldn't hear about otherwise. But we are going to try next year and theme some of those sessions. We want to do one around disability, so that we can kind of focus digital inclusion around disability. But we also want to look at complementing that with some additional lived experience, so that we're including some patient perspectives. So you might see just a little bit of a different balance into next year. We're more than happy for anybody additionally to join us, so please do share onwards. It's always a good learning content, and for me also that option to network with people. Daniel's made some good connections today, and we can see some of that chat in the presentation as well. So thank you everybody. I'm giving you 6 minutes back, you will be pleased to hear. So have a wonderful week and make the most of every day, and we look forward to you joining us next time.